Needless to say, the last year has been pretty tough on all of us, but hopefully we see better days in 2021. The next clip is about Apollo Medical Holdings, which is a leading healthcare company that integrates cost-effective solutions for healthcare providers, physicians, and health plans. They've been a huge part in helping fight COVID-19, especially for the Chinese and Asian community in the greater Los Angeles area, and we just want to shout them out.
We're the first, before anyone else, before the government, before the county, before the city, before the state did anything for our population in the San Gabriel Valley, in the Chinese community. We were the first one to have a drive-through testing, right, taking care of our members. Well, first and foremost, thank you for having me. My name is Dr. Kenneth Sim. I'm a surgeon by training. I'm currently the chairman of the board of Apollo Medical Holdings and Allied Pacific IPA. My understanding is this is the 122nd annual Golden Lunar Parade. And despite this very difficult times with the pandemic, I really want to thank you all for the wonderful efforts you're putting up to continue this tradition on behalf of the Chinese Chamber of Commerce of Los Angeles. So thank you all. And thank you for having me. It is a huge project, and there are many reasons, right? But first and foremost, the most important reason is really to maintain the providers, the doctors network in Chinatown to serve the community. But as we all know, when a community loses a hospital, the next thing that happens is you lose all the doctors, right? They all move away because you don't have a hospital to practice in anymore. So the fear was, at that time, a couple of years ago, was that if we don't do something to keep these doctors intact, to provide those medical services in Chinatown, the community will be left behind without the convenient and immediate medical services by these doctors. Of course, there are other reasons, right? There are also personal reasons from my own perspective and for my own colleagues and my partners in Allied Pacific IPA. I grew up in that environment, using Chinatown, the French hospital then, to care for our families. And later on, when I became a surgeon, in my earlier part of my career, I actually, myself and many of my colleagues, practiced at a French hospital. I did surgeries there, and I was a part of the medical staff. So from a personal perspective, it was important for us to emotionally to want to help that community and help to keep that piece open as much as we can. All of our efforts to rebuild, the urgent care clinic, the multiple multi-specialty specialty group, the primary care pieces and all that, it has been slowed down and hampered a little bit by the pandemic. But my hope is, and my own vision is, once the pandemic is over, there will be a robust and a vibrant repatriation, hopefully of our younger generations, along with our older folks in Chinatown, to come back to Chinatown and to come back to the LA downtown area. And Ally will be committed to continue to step up, improve, and serve the community well. I'm very proud. I think I am very, very proud, and our organization is also very proud for the work we have done in helping our community toward the COVID-19 pandemics. This is, in my 35 years of practicing as a surgeon, this is probably the worst times with a pandemic as such that truly has ravaged our community in every single ways of life you can think of. We're proud because we're the first one. Allied Pacific is the first physicians organization that started a drive-through testing for COVID, in joint partnering with our hospital partner, Garfield Medical Center. And the ongoing efforts is we kept all of our urgent cares open, right? In Chinatown, in Arcadia, in the Hacienda Heights area, in the Montreal Park and Alhambra. We kept all of our urgent care centers open 7 days a week to service the COVID patients, right? We have continued to ask our staff to not stop working at all, although 90% of them today are working from home. They are continuing their best efforts to provide the care with authorizations, medical services, without any disruptions throughout this whole pandemic time. So today, we have successfully vaccinated all of our healthcare providers, all our first line folks that are working in the hospitals. And then secondarily, we have been successful in vaccinating all the office folks that work for these doctors, so they don't stop coming to work, right? So now we are diligently looking at a joint venture community efforts between the hospitals, Allied Pacific IPA, and some of the local federally qualified clinics to jointly looking at vaccinating, the next step, all the seniors that are 65 years or older. So it's an ongoing effort that Allied Pacific had put it at the top of our agenda during this time without any interruption of services to our patients, maintaining the medical offices open, keep all of our operations open, our outpatient surgery centers open, Sun Lab, our laboratory partners open all the time. They're doing 1,000 testing a day. Sun Lab, actually, our partner, went out there and got 2 machines. And these machines can perform testing up to 1,000 tests per day with a 24-hour turnover time. So if I were to go this morning to get a test, I can potentially get my results back by tonight or by tomorrow morning. So that has been extremely helpful through the joint collective efforts of all of us to take care of our patients in the hospitals, our patients in the outpatient, and in the doctor's offices. We are physicians, always will be physicians, first and foremost. So this notion about us being business people, entrepreneur, those are all secondary, right? But it is true that 7 of us, my 6 of my partners, myself, started this company in 2006. And to fast forward to today, we have really built out this company with our bare hands, if you will, from nothing. The idea really is, it's not so much, to be a public company or whatnot. Those are all secondary. The important thing is this notion of how we can, each one of us from our own kind of a solo practice, if you will, like a mom and pop organization, how can we sustain? How do we continue to provide the sustainabilities to bring in new doctors, to bring the younger generations, to continue to serve our community, right? Because in my 30-something years, and all my other partners have all been here for 30 years plus, the community has been very good to us. Right? And it truly is our obligations and our responsibilities to have a very clear plan to keep bringing the best, the youngest, and the most talented physicians to come back to serve in this community. But the idea behind it is, how do we physicians learn how to work together while we are maintaining our individual autonomy, but learning how to work together to build a larger piece that's sustainable with a single common goal and vision, is that to make sure that beneficiaries, the best beneficiaries, the group that will benefit the most from our work will be our patients, right? So that's kind of the collective vision in a high level, why we're doing this. Well, if there's a dream, actually to us is, for folks like myself and many of my colleagues, we are the first generation, right? We are immigrant that first came to this country at a young age, and we're given this great opportunity, to go to school here, go through training, become physicians, and have the support of the community to get us to where we are today. From our perspective going forward, we want to continue to complete our mission and our vision, right? Which is to provide the best quality at the lowest cost, right? To help with this whole challenge with the healthcare system and expenditure in the United States. So in so doing, we're looking forward to extend. The idea is to find like-minded physicians with similar appreciations of our values and join up together with them and build a much larger company. So that's kind of what I'm hoping to continue to build the company outside of California. I'm sure, all the folks around us in the company would like us to have that tradition of giving out the red envelopes again, either virtually or by mail or whatever. But I personally is going to enjoy your virtual 122nd Golden Lunar Parade and share that with you and spend a day watching this what I expect to be a wonderful, wonderful parade. And to that end, I also want to thank all the board of directors of the Chinese Chamber of Commerce of Los Angeles, and thank you for inviting me today to share some of my thoughts with you, and wishing you a very successful chamber year, and I will do whatever we can contribute to your success. I want to say this in Cantonese, right? Because I'm Cantonese. So 祝大家新年快樂，身體健康，多謝你哋，thank you。